Hello, welcome. My name is Mamie Allen, and I'm an instructor here at UMA. Today we will be discussing the nervous system part 2, where we'll take a closer look at some of the pathology and also other medical conditions relating to the nervous system. Let's dive in. As we begin to dive into some disorders of the brain, it's also important to understand the term cognition. And this would describe our mental activities that are associated with thinking, with our learning, as well as with our memory. So the first disorder we have here would be dementia. And this is a slowly progressive decline in one's mental abilities. This would include their memory, their judgment and thinking, and it's often accompanied by some personality changes. You may hear the term senile dementia, and this would just be referring to someone or the elderly aged. Next, we have vascular dementia, and this would be a form of dementia that's caused by a stroke or some other restriction of the blood flow to the brain. Now, although Alzheimer's disease is the primary cause of dementia, vascular dementia accounts for about 10 to 20% of all of the cases. Next, we have encephalitis. If we were to break that down, encephal means brain and itis means inflammation. So encephalitis is an inflammation of the brain, and it can be caused by a viral infection such as rabies. We also have neurodegenerative diseases. The term neurodegenerative disease is also called degenerative nerve disease, and this would be an umbrella term that's used for disorders in which there is a progressive loss of the structure or the functions of our neurons. So looking here, we have Alzheimer's disease. This would be a group of disorders that involve parts of our brain that control our thoughts, our language, and our memory. It's also the leading form of dementia, and it's marked by a progressive deterioration that affects both our memory as well as our reasoning capabilities as an individual. Next, we have Parkinson's disease. You may see this abbreviation of PD, and this would be a chronic degenerative central nervous disorder that's characterized by fine muscle tremors, sometimes being rigid, as well as a slow or shuffling gait. When you hear the term gait, this would describe the manner in which someone walks. Now, this slow or shuffling gait is caused by that gradual progressive loss of the control over the movements, and this would be due to those inadequate levels of the neurotransmitter of dopamine that's present in the brain. Here we have some related combining forms specific to this body system. So we have the structure in the first column, and then related combining forms in the second column. So from here we can see cerebro as well as encephalo identifies the brain, myelo, the spinal cord, and then neuri or neuro will identify the nerves. Keep in mind that letter of O makes it the combining form, whereas the cereb or the encephal will be the root word. But once we add that O, it then becomes a combining form. Here we have some other disorders of the brain. We have Reye's syndrome. You may see this abbreviation of RS, and this would be a potentially deadly disorder in children, and is characterized by vomiting as well as confusion. Now, this syndrome will sometimes follow a viral illness in which the child was treated with aspirin or some other type of medication. Tetanus. Tetanus is also known as lockjaw, and this is an acute and potentially fatal infection of our CNS, and it's caused by a toxin that's produced by our tetanus bacteria. Now, we attempt to prevent tetanus through immunization, but keep in mind, in those who are unimmunized, this condition is typically acquired through a deep puncture wound. And then we have Tourette syndrome. You may see the abbreviation TS, and this is a complex neurological disorder that's characterized by involuntary tics or grunts, and also compulsive utterances that sometimes includes obscenities. Patients that suffer from brain injuries can experience amnesia, and this would be a memory disturbance that's characterized by either a total or a partial inability to recall your past experiences. Now, this condition can be caused by a brain injury, an illness, or a psychological disturbance. Next, we have concussion. And a concussion includes a violent shaking up or a jarring of the brain. If we were to break this term down, concuss would mean shaken together, and the suffix of ion or the ion would mean a condition, or you can say a state of. So a concussion may result in a temporary loss of awareness and function. You can compare this to a cerebral contusion. Speaking of a cerebral contusion, this would be the bruising of brain tissue as the result of a head injury that causes our brain to bounce back against that rigid bone of the skull. Breaking this term down, the contus, the contus, means bruise, and the ion, or that ion is the suffix again, would mean condition. And you can compare this with a concussion. Take a look at the next injury, cranial hematoma. This would be a collection of blood that's trapped in our tissues of the brain. Breaking this term down, hemat, or you may hear hemato, would mean blood. The O, remember, is just that combining form that we add. And then oma, OMA, is meaning tumor. Now, with cranial hematomas, they're named for their location. The types of cranial hematomas can include an epidural hematoma, and this would be located above our dura mater, or subdural hematoma, and this will be located below the dural hematoma, I should say. And then we have cranial hematomas that may be caused by that major or minor head injury. Now, a more severe brain injury we will refer to as a traumatic brain injury. And this is a blow to the head or the penetrating head that damages the brain. Keep in mind, not all blows to the head will result in damage to the brain. So when an injury occurs, it can range from being mild with only a brief change in one's mental status to severe with longer lasting effects. As an example, we have here the shaken baby syndrome, and this results of a child being violently shaken by another. This action can cause brain injury as well as blindness, fractures, seizures, paralysis, and death. Remember, whenever you hear paralysis, this means immobility. The nervous system also includes different levels of consciousness, and our levels of consciousness describe the measurement of our responses to different arousals and stimuli. Now, we also have altered levels of consciousness, and you may see the acronym ALOC, and this will refer to a decrease in our consciousness that's due to injuries, diseases, or other substances such as medications that we may be prescribed, drugs, or even alcohol. Now, let's take a look at some of these different levels of consciousness. Being conscious is a state of being awake, alert, aware, and then responding appropriately to different stimuli. When one is unconscious, this is a state of being unaware or unable to respond to that stimuli, and this would also include responding to pain. Look at lethargy. This is a lowered level of consciousness, and it's marked by listlessness, or we may say drowsiness and apathy. Apathy means indifferent and a reduced level of activity. Now, if we look at the term lethargic, this refers to a person who is at this level of consciousness. Next, we have the stupor level of consciousness, and this is an unresponsive state in which a person can be aroused, but only briefly, despite effortless attempts. Then we have syncope, and syncope is also known as fainting. Syncope is just a medical term. Here, this would be the brief loss of consciousness that's caused by a decreased flow of blood getting to the brain. The next level of consciousness would be a coma, and this would be a deep state of unconsciousness that's marked by the absence of spontaneous eye movements, as well as the lack of speech and no response to painful stimuli. The term comatose just refers to a patient who's in a coma. The next level of consciousness is persistent vegetative state, and in this type of coma, the patient may exhibit alternating sleep and wake cycles. However, due to that severe damage to certain areas of their brain, the person is unconscious even when they appear to be awake. Delirium. This would be an acute condition where the patient experiences confusion, disorientation, agitation, some disordered thinking and memory, as well as hallucinations. Now, this condition is usually caused by a physical condition that's treatable, such as a fever or a high fever. An individual or patient suffering from this condition would be described as being delirious. The term brain tumor means an abnormal growth that's located within the cranium or inside of the skull. So, a malignant brain tumor would be life-threatening and invasive, and this would destroy brain tissue. When this cancer originates in the brain, it's considered to be the primary site. But if it were to spread, meaning to a secondary site, we consider that metastasizing. So it may originate in one place, but spread to that secondary site. Next, we have a benign brain tumor, and this would be non-life-threatening, and it does not invade any brain tissue. However, the patient may experience pressure of those adjacent anatomical structures. And then we have intracranial pressure. If we were to break that term down, intra is meaning within, crani meaning cranium, and then all, or that AL, means pertaining to. So this would be pertaining to the amount of pressure that's inside of the skull. A stroke, or a CVA, is also known as a cerebrovascular accident. And this will come from damage to the brain that occurs when that blood flow is disrupted, either because a blood vessel is blocked or because it has ruptured. Here we can look at the acronym FAST, which is a test that can be used by members of the public as well as first responders to see if a stroke is actually occurring in a patient. So FAST stands for, the F is facial droop, and here one side of the face droops or does not move equally when the person smiles. The A would be for arm drift, and this would be a weakness on one side of the body, and this would be demonstrated by one arm drifting down when the arms are extended. We also have the S for speech abnormality, and this would be a slurred speech using the wrong words or a person being unable to speak. And then the T is for time. And if any of these signs are present, immediate conveyance of the emergency room would be essential for the treatment, such as thrombolytics. We now move on to some disorders of the spinal cord, or we can say disorders of the vertebral column. The first is myelitis, and this would be an inflammation of the spinal cord. This is an easy one to break down. We know the suffix itis means inflammation, and then the myel, the M-Y-E-L, means spinal cord and bone marrow. We also have myelosis, and this would be a tumor of the spinal cord. Breaking this term down, we have myel, again meaning spinal cord and bone marrow, but the suffix here, osis, means an abnormal condition. Myelosis also means an abnormal proliferation of the bone marrow tissue. Poliomyelitis. This is also known as polio, and it's highly contagious, and it's a viral infection of our brainstem and spinal cord that sometimes can lead to paralysis. If we were to break this term down, polio, or poli, means gray matter. The myel, M-Y-E-L, means spinal cord and bone marrow. And again, as always, the itis means inflammation. Presently, there's no known cure for polio. However, it can be prevented through vaccination. Multiple sclerosis. This would be a progressive autoimmune disorder that's characterized by inflammation that will cause the myelin sheath to become demyelinated, meaning no covering at all. Now, this will scar the brain, the spinal cord, as well as our optic nerves, and disrupt the transmission of those nerve impulses. So remember, demyelination is the loss of patches of the protective myelin sheath itself. Moving on now to those feelings or abnormal sensations that one may experience. We have causalgia, and this is persistent severe burning pain that usually follows an injury to a sensory nerve. Let's break this term down. We have cause, the C-A-U-S, which means burning, and then we have algia, the A-L-G-I-A, which means pain. Next, we have hyperesthesia, and this is a condition of abnormal and excessive sensitivity to touch, pain, as well as other sensory stimuli. Breaking this term down, the hyper means excessive. The esthesia, the ESTHESIA, means sensation or feeling. Some other abnormal sensations would be paresthesia, and this refers to a burning or prickly sensation that's usually felt in our hands, arms, legs, and feet, but it also can occur in other parts of the body. Breaking this word down, par meaning abnormal, and esthesia means sensation or feeling. Then we have peripheral neuropathy. This would be a disorder of our peripheral nerves that carry that information to and from our brain and spinal cord. If we were to break down this term, neuro is meaning nerve, and pathy is meaning disease. So neuropathy is any disease or damage to a nerve. But we have two types. We can have mononeuropathy, which would be a damage to a single peripheral nerve, and we also have polyneuropathy, and this is when multiple peripheral nerves are damaged. To diagnose patients, physicians will use different diagnostic procedures to do so. Here we have an MRI. If we were to spell that out, that would stand for magnetic resonance imaging. And we also have CT, which is the computed tomography. Now, both of these are important neuroimaging tools because they facilitate the examination of the soft tissue structures of our brain and spinal cord. So a functional MRI would detect any change in our blood flow in the brain when we are asked to perform a specific task. This gives the physician a clearer picture of the brain tissue that's relevant to accomplishing that task. Next, we have the carotid ultrasonography, and this is an ultrasound study of the carotid artery. Ultra would mean beyond, sono is meaning sound, and graphy means the process that produces a picture or a record. We also have echoencephalography, and this is the use of an ultrasound imaging to create a detailed visual image of the brain for diagnostic purposes. Breaking this term down, echo meaning sound, encephalo meaning brain, and then graphy again means the process of producing that picture or record. Within the nervous system, a person may also experience a phobia. And phobias would be persistent, irrational fears of a specific thing or a situation, and that fear is strong enough to cause us distress. Now, that distress begins to interfere with our functioning and then allows us to avoid the situation or that thing. Now, there are different types of phobias. We have acrophobia, and this would be an excessive fear of heights. If we were to break this term down, acro is meaning top, and phobia means abnormal fear. Agoraphobia. This would be an excessive fear of environments where you fear a panic attack may occur. In order to avoid these types of situations, a person suffering from agoraphobia may not even be able to leave their house. Agora, when we break this down, means marketplace, and then phobia means, again, that abnormal fear, agoraphobia. We also have claustrophobia, and this would be an abnormal fear of being in those small or enclosed spaces. If we were to break this term down, claustro is meaning barrier, and the suffix phobia means abnormal fear. Social anxiety disorder may also be referred to as social phobia, and this would be an excessive fear of social situations where you may feel negative evaluations by others, embarrassing either yourself or others. There are also mental health disorders within our nervous system, one being obsessive compulsive disorder, which is also abbreviated with OCD. Now, OCD is characterized by those recurrent obsessions and or compulsions. OCD can make you feel you must do those compulsive behaviors. It may be repeated cleaning, or it may be repeated checking that the doors are locked. You're performing these functions to prevent harm or to stop this obsession. Performing these compulsions will provide only temporary relief, but not performing them temporarily may cause the person anxiety. We also have hoarding disorders. And hoarding disorders are characterized by the overaccumulation of one's belongings in a way that it interferes with their daily living. Hoarding can create unsafe as well as unsanitary living conditions that can lead to worse medical problems. To treat conditions of the nervous system, we have procedures such as a neuroplasty. And a neuroplasty would be a surgical repair of a nerve or multiple nerves. Breaking that term down, neuro would mean nerve and plasty, the suffix, means surgical repair. We also have neuropathy. This is surgically suturing together the ends of a severed nerve. Neuro, again, is meaning nerve, and the RRHAPHY means surgical suturing. We also have a neurotomy. When you think of otomy, remember that means inserting into or making a surgical incision into. So neurotomy would mean the surgical division or dissection of a nerve or nerve ending. Neuro again means nerve, and otomy is that surgical incision. To wrap up, in today's lecture, we discussed different procedures that are used to treat conditions of our nervous system. Are you ready for your next chapter? Good luck in your studies this week.